So glad to have everyone back on Mastering Counseling. We are thrilled to have Dr. Rob Weiss, who is a chief clinical officer of Seeking Integrity. He has authored 11 books and is coming out with another book. He's been all over
The
to like
globe.
over 100, internationally to over hundreds of conferences. He also has his own podcast, which I'm sure we will hear about. His main focus and the clients that he helps is for those struggling with substance abuse and sexual addiction. So thank you for being here today, Dr. Rob.
I'm so glad. Whenever I can tell people about this stuff, Becky, it's an opportunity to provide healing.
Well, we're very thankful for your time and for the insights that we're going to gather. So, why don't you go ahead and share with us how did you fall into this realm of your practice with these type of addictions?
Well, if you haven't noticed, I'm very old. And so I first entered the field. First of all, I am a sex addict. So I struggled with these issues when I was younger, related to a whole bunch of trauma, and I acted out a lot in my 20s. And right around that time, HIV/AIDS came along. That's how old I am. And there were no cures and there were no answers, and people were dying all around me. And I thought, I bet there are people whose sexual addiction drives them into saying not into saying yes when they should say no. And I
Mhm.
know some of them are drug addicts, I know some of them are whatever, but some of them are sex addicts, and no one's talking about this at all.
Right.
And in my training, in my own recovery, I went to grad school, I went to UCLA, got my master's in social work, and this was my topic. This is what I went out and taught about and talked about. And I don't think anybody who is necessarily my experience of if you weren't a gay man and you weren't dealing with this all around you, no one wanted to hear from you. So I
Mhm.
had a unique opportunity to talk about this issue and wrote a book about it, and that was sort of the start of it all. Interestingly, though, I'll say this real quick. I am a gay man, but even then, 90% of my clients were heterosexual men who were married. Um,
Interesting.
so
Yeah. Um, Yeah, thank you for talking about the start of it and going personal. And we see that a lot on this show where it's part of someone's life and then they want to help other people work through those type of issues. So, why don't you talk to us about some of your books that you feel most proud of or have helped the most people? What are some of those titles and the focus of each book?
Well, I first of all, I'm a crazy person. Like, who writes 11 books, And Lord knows if you told me that, I'd be like, yeah, right. I can barely write an article. But it is a passion of mine to write and to really to get the message out, especially about sex addiction and drug and sex addiction, because nobody talks about this stuff. So
Hmm.
anyway, I've written a number of various versions of Sex Addiction 101 as the years have gone by. I wrote about it when there was no tech, and then I wrote about it when there was AOL, and now I've been writing about it with apps. And so over the years I've had to write books, but Sex Addiction 101 is sort of the basic primer, I never know how to say that word, to sex addiction. And my most popular book, interestingly, is a book called Out of the Doghouse, a
Mm.
relationship saving guide for men caught cheating. And what I wrote this for is men who cheat or have cheated and they get caught and they've cheated on a woman. Because men do not understand on any level, no man understands what a woman goes through when she's cheated on. We think
Mm.
flowers and candy, and it's been 2 months. Like, aren't you over it? And, all of that. And we don't understand what betrayal really means to a woman because it's different for men. So I
Hmm.
wrote Out of the Doghouse because men need to understand what empathy is and compassion is and how cheating and drug use affects the family life and women in particular. So I'm very proud that this is, of course, my best-selling book because all these men are in trouble and they
Hmm.
want to read Out of the Doghouse to figure out how to get out of trouble. In
Hmm.
fact, just to say this, women buy 95% of all self-help books, 95. So
Hmm.
if I write a book for men, I have to write a book that a woman is going to pick up and throw it at her man or her woman, whatever. Um, I think the book that I'm proudest of is a book called Pro-Dependence.
Hmm.
And pro-dependence is a vision of turning codependency upside down. I don't believe in codependency. I think it's a really negative label that's applied to people who are just doing their best. And
Hmm.
I've sort of turned the whole thing on its ear with pro-dependence and said, you don't love someone and stay with a troubled person because there's something wrong with you. You stay with a troubled person and help them because you love them.
Hmm.
And when you start from why you're really with them, which is love, rather than your repeating pathology of the past, which is codependence, it's actually driving the field forward. And I feel really grateful for that. So I've had one thing as legacy, it's codependence.
Hmm.
Because I believe that families are are coming from love, despite how we might look at their behavior.
Yeah. Thank you. Very interesting. And I love that point. You're writing it, you got to get the women to want to read it before it's getting to any guy.
Guys don't
So,
read self-help books. Come on.
right. Um, let's talk a little bit about how do you see the effect of media in the issues that a lot of men are dealing with? And maybe we should clarify, do you only
Women
work with
too.
men or you work with
No,
both?
I
Okay.
run a men's residential program. You cannot
Okay.
mix the male sex addicts and female sex addicts. Not a good idea. And
Right.
even the gay sex addicts with other men will tend to not act out in that environment. So, but I have run women's programs, and I think I created, the first women's program in the country for women who have sexual disorders. Interestingly about women, I'll just say it, is they don't come in saying I'm a sex addict or I must have problems with drug and sex. They filter into my world by they have a problem with eating, and it comes up
Mm,
every time have a broken relationship. They have a problem
mm,
with drugs, but their partners are always drug addicts and they go from one to the other. So it is
mm,
often their sexual romantic behavior that has caused other addictions in women, and but they don't talk about that. And
mhm,
I'll say to you, Becky, one of the main reasons why it's so important to me about this work, especially if we're talking to substance abuse counselors, is you have to ask about sex.
mhm,
And you and I were talking earlier about the guy who goes to residential treatment, or woman, for substance abuse, substance disorder, and no one talks to her about her sexual life. And I'm not talking about past trauma. I'm talking about what she's doing now.
mhm,
And when you come to realize, if you ask the right questions, that she relapses over the men she sees that are using, she relapses over her problem with porn. No one asks these questions, because who would ask about that? And then you're missing a whole part of relapse and recovery is by, sex is as important. Well, let me just say this: therapists are not trained to talk about sex. We're
mhm,
just not, and we're uncomfortable with it. And so we just sort of skip it. And unfortunately, that's probably one of the most shameful issues for people is sexual issues. And
mhm,
so I'm here to say you got to learn about it and you got to talk about it.
mhm. Yes, thank you. I did see on your website too that you offer for people who have been betrayed, you offer support for them and empowering them. Talk to us about that side of it.
Well, I think being betrayed, if you're a woman, and I'm going to speak from a heterosexual perspective because that is my most frequent client, and mostly it is women who are married to men who are cheating. And I think we've just begun in the last, at least in my world, and I think we're pretty leading in this area, probably in the last 20 years at looking at the pain of the partner.
Hmm.
And again, in codependency, you say, well, what did she do that is driving this addiction? What is she? She's nagging, she's complaining, and that's how we used to look at the partners as they were a problem. They were contributing the problem. And I think, what came out of my field was some woman who said, how could I possibly be responsible for my husband seeing 300 sex workers? And it was like,
Mm,
oh, yeah, you could never be responsible for that. And that's when the whole switch to looking at partners as coming from love and not in any way supporting the problem came out of. But in any case, there's been a real refocusing on partners um, in the last 20 years. And a lot of us have taken that up because the focus is always on the addict. They
mhm,
go to treatment. We deal with their issues. We bring the spouse along in and say, well, here's some things you can do or shouldn't do. And out they go. And
mhm,
what the spouse's experience. And let me just say this: the addicts have been treated for addiction, which is very directed, very clear. You need to do this, don't do this, accountability based. The spouses need the opposite. They need to grieve. This isn't the relationship I thought I have. I never thought he would start drinking and any of this would happen. They feel violated and are in some ways by the circumstance. If you had cancer at 35 and we had two kids, I think the whole family would feel victimized by this horrible illness. But for some reason, if I'm drinking like a fish and I'm an addict, they don't feel bad about you and call you an angel. They see you as part of the problem. And so we've really turned to, in a very compassionate way, to spouses and said, what is your experience? And found it to
mhm,
be very different than the sort of popular ideas about that.
mm. So interesting. Thank you for all of the insights on that. Can we talk about your podcast and who's coming on there? What things are you focusing on? What is the purpose of it?
Well, I was mentioning you earlier, Becky, that about 4 years ago, I was thinking about doing a podcast, and I thought, one of the reasons is all I heard were things about fashion and things about movies and things about, those sort of lighter topics. And I thought people really do want to learn more things. So I started a podcast called Love, and Addiction, Sex, Love, and Addiction. And, I thought a few people would listen, it might be interesting. And we've had literally over 1 million downloads.
Mm,
And the people who are going to be listening it are my husband's been cheating on multiple times, or I'm really struggling with my porn problem. I don't understand it. Why can't I keep my commitment to my partner? How could he love me and do this to me at the same time? So I think the spectrum is from people who are dealing with cheating and trying to understand that, all the way to I've been married for 30 years and I just found out that my spouse is doing all this stuff and I had no idea. And, what do I do now?
mhm,
And everything in the middle. Is it an
mhm,
addiction? Is it not? So the people who are on there are really, I think, some sort of top tier professionals, Sue Johnson and Harville Hendricks and Stan Tatkin, and people who really understand the work from an intimacy and relationship perspective. And I interview them. And we sit and talk,
mhm.
what saves a relationship? What causes problems in a relationship? How do you look at it from a psychological way? How do we help couples heal betrayal? I mean, we're talking about all that stuff, and I like interviewing people like you probably do because I
Of
don't have to
course.
say much. You're like, tell
Hmm.
me about this, and then I can
Yeah.
just be quiet. So I think there's a lot of fascinating. What I hear, and I'll just say this, is people go to sex, love, and addiction, and they write me and they say, I never understood what was wrong with me. And now I get it. Or a spouse says, I always kind of suspected this, but now that I'm listening to this, I know what it is. And then they go
Mm,
watch me on YouTube, and then they find me on Wikipedia, and eventually they call. So,
mhm.
what I consider podcasts is a free educational service or an opportunity for people who may never go to therapy, never get support group for whatever reasons, and they get to learn healing from this process. And I love doing them.
Um, yeah, yeah, that's so interesting. I feel like a lot of it is personal, and then a lot of it is the people helping the clients for sure. Um, can you talk to us about seeking integrity? Are you the solo practitioner? Are there others? How has it changed and evolved over the years, or has it stayed the same? Tell us about your practice.
So this is about my sixth. Remember, I'm old, so I've been doing this a long time. This is about my sixth. I've been clinically licensed for 30 years as a social worker, and I have a PhD in human sexuality, which means I know a lot about sex, um, for about 8 years. And so, but I have opened a numbers of treatment centers over the years, and I've opened them in residential, in treatment, like in a hospital, and I've
Mhm,
opened them outpatient, like we're doing intensives and workshops. I've always been interested in working as a team. I think that
mhm,
everyone has something to contribute. So solo practice, I always found is lonely. And I'm also not getting the feedback that I want about cases that we're sharing and our own experiences. And I wanted to lunch with people. This is hard work. And so I've always created and worked in group environments. So
mhm.
Seeking Integrity, hopefully, is my last program. That's just
Okay.
because I want to have some fun time for myself. But it was created for two reasons. It's an 8-bed residential, you come live here program in California that is focused on men who are sex addicts and men who have a combined problem with sex and drugs.
Mm,
And in particular, I am interested in the population of sex and drugs because no one really says this is my specialty.
mhm,
Um, and we see people for 2 weeks, 3 weeks, 4 weeks who involve their spouses. It is a 24/7 opportunity for them to take a deep dive into themselves. And we're holding up a mirror, which is what treatment is, and saying, oh, you looked at your life this way. You said you wanted to be a good family member, you want to love your kids, you want to be, really involved in your church, but look how you're living,
mhm,
and you're doing this and you're doing that. And so it's the kind of therapy we do, and I think addiction therapists do, which is cognitive behavioral, is very much about what are you thinking and what are you doing? What are your goals? And yet, how are they being undermined by your behavior and continuing to show the person their distortions and their denial?
mhm,
So the other piece I think we do at Sexual Integrity, Seeking Integrity, it's about sex, I should know. We're looking at trauma.
mhm,
Every man I work with had bad things happen to them, and usually the same kinds of things, which is a whole other subject. And that is not the focus of treatment, because healing trauma, and I want everyone to hear this, you can heal someone's trauma, you can work through their issues, you can look at the past, I can look at a whole movie about their whole life, but it's not going to stop them from drinking. It's not going to stop them from sexual acting out. And that requires a different form of treatment than how are you doing? What's going on? I'm sorry your mom did that. Tell me more about that. And I'm being a little sarcastic, but the truth is, it's this kind of work is specific. It's very directional. It's very accountability based. There is structure and things they need to do and follow through on. And the trauma is kind of a reflection of, wow, I can see how you got here rather than being the primary focus. Because again, uh, looking at past issues raises anxiety for people, and anxious people use and act out. And so I have to find a platform for them to stay sober, stay stable for a while, and then they can be look at the past and their relationship issues. I don't think anybody stops drinking or using or sexual acting out or gambling because they understand their past.
Hmm.
If you don't mind my saying, I had a guy in a group the other day, and I said something about, what are you going to do when you are passing a massage parlor and you've had a couple of drinks, or whatever? And he said, well, my mother did this and this happened to me. And I'm like, but you're walking into a massage parlor and you're drunk. How does you think you're going to stop there and say, oh, well, my mother, that's not it. How are you going to protect yourself? How are you going to, all of relapse prevention?
Hmm.
So, but you also have to do mental health work. I have to know if that person is bipolar. I have to know if they have OCD. I have to know if they have ADHD. Not necessarily that that is driving the problem, but it may make the problem harder to resolve unless we look at it. And that's another thing
Absolutely.
I think addiction programs really miss, is the mental health piece. They're
Hmm.
so focused on drugs and alcohol that they didn't notice that this person, has a personality disorder. Or so I think what we do is seek integrity. Seeking integrity is a very holistic look at relapse
Hmm.
prevention, stopping the behavior, dealing with spouses who have their own therapist, looking at the past and helping. There's a reason the word integrity is there. I
Right.
want these people to integrate their lives and be one person whose beliefs are matching their behavior.
Um, so fascinating. And we are hearing a whole lot of that on here with the more holistic approaches, people pulling in doctors, people wanting blood work before they even start treating, because it's just there's so many other things and diagnoses that go along with the mental
Well,
health.
let me say, Becky, that a good therapist who's trained well, the first thing we look for in anybody is medical. The medical. Is there anything, going around? Does this person have emotional problems? They have brain problems. I mean, sorry, do they have physical problems? Is there something that? So we always have to think, just because someone comes in for a mental health problem, are they physically healthy? That's the first thing we should look at, and then it
Hmm.
goes down the block. So you're right. There should be blood tests. There should be. With my folks, it's STD.
Mm,
Oh, you've had sex with 25 people in the last, year, and you were snorting coke during that. Do you think you got a disease? What were you doing during COVID? All those kinds of things. So yeah,
mhm.
the medical in certain circumstances for sure has to be addressed. And then the mental health.
Let's talk just a little bit about, since your main form of therapy with seeking integrity is a residential with the 8 beds. Um, how does that work, a little bit on the business side? Like I assume you have cooks that you hire or
Hmm.
cleaning. Talk to us about that
Hmm.
angle and the center and all of that.
Well, in some ways, I run a hotel.
Okay. Yeah.
We have a really, really nice house, nicer than mine, by the way. And they have it, and there's a full-time chef. And in California, you've got fancy chefs, and that I don't have at home either.
Mm,
But anyway, and there's a cleaning. The goal really of residential treatment in terms of the environment and the hotel part is I want them to be really comfortable. We're not talking about massages and facials and going on spiritual journeys, although they may have one internally. I'm interested in the issues. So I don't want them to be distracted by the house is dirty. I don't want to be distracted by the food
mm,
is terrible, because then they're coming into treatment, they're complaining about that rather than dealing with the issues. So
mhm,
I don't need them to have luxury, but I think a comfortable working environment. The thing I love about residential treatment is someone is literally in treatment all day long. And I think treatment has to be very structured every single day. So they have group here, they have an educational session here, they have psychodrama there, they have some kind of processing, and every single day, because what makes people feel safe is structure.
mhm,
They want to know who they're seeing. They don't want, again, they want to not have to worry about what is my next group, whatever. So we're running them through that, but then they go back to the house. And what they may not fully know is everyone's watching. All the staff is watching. How did this person who was upset in treatment that day, are they isolating in the house? Are they
mm,
staying in their room? Are they talking to someone? So we're watching 24/7. My
Wow.
favorite story about this is when I did have an outpatient practice and my clients would come see, the receptionist and they, do whatever they do. And they would often say, where is he and why is he late? And, this is unacceptable and, all that. And then I'd open the door and be like, hi, Dr. Weiss, how are you? Nice to see you. And the relationship in that team, so that receptionist could come to me and say, it's interesting to me because he was such a jerk with me and he was so nice with you. That's kind of what residential is I get to see the pieces that you might
Hmm.
not ordinarily see, that
Right.
I can then pull into the work.
Hmm.
I love doing
Um,
residential.
yeah. And that's what you're fully doing in seeking integrity, or are you doing like weekly clients as well? Or it just depends.
So what we do is we give away 90% of our work. So if you go to the Seeking Integrity website, which is seekingintegrity.com, you will find out that there are about 15 groups that have volunteer therapists. So I have
Hmm.
volunteer betrayed spouses groups. I have volunteer addicts group. I have volunteer groups that are being run for men who are divorcing or women who are considering it. So, what is sex addiction? I have a sex and drug problem. There are support groups for all of those people. There's tons of webinars and trainings. And what I believe is that, as I said, not everyone has the opportunity or the resources to ever really get to therapy. And then there
Hmm.
are people who are in therapy for an hour, but they don't have the opportunity to learn all this stuff because what can you get in an hour? So the
Hmm.
goal is, so we have tons and tons, far more than we charge of free stuff. And
Hmm.
then we do work groups. So if you have a sex addiction problem, there's a 6-week course with a workbook and homework. And, if you're a betrayed partner, there's how do you figure this out? How do you work through it? What is betrayal? So we are educating, we're doing support stuff for free, we're doing education stuff for free, we're doing education stuff that we charge for, and then we're sending people to residential treatment. So the big answer to your question is no. We are not an outpatient center. I'm more interested in the client who comes from, Asia, who comes from Africa, who comes from South America. We get those folks all the time. Um, there are plenty of local outpatient therapists,
Hmm.
but they don't have the platform, the podcast, the books, the YouTubes, the opportunity to educate at a larger level.
Yeah.
And I have the opportunity because of my work to make a global impact. Ooh, how's that? That sounds
Yeah.
really arrogant. Um,
No, that I was going to ask how far are people coming, but you answered that from all around the world. So that is,
they
yeah,
do.
really amazing. Um, One thing that I was thinking about was with this, the addiction of sex and everything, do you find yourself in the realm? I used to do work, against human trafficking. Do
Mm,
you do you have any angle in that where the guilt and clients, or I don't know, is it connected? Is it
yeah.
part of your work or no?
Well, I think that the men I work with are so caught up in the fantasy of what they're doing, and that's part of your if your daughter was doing this, your 19-year-old daughter or your 22-year-old daughter, how would you feel about that? How would you feel
Mm,
about the people who are looking at her? How would you feel about the people who are paying her? Okay, so how is it you could feel that way about your daughter who's 20, but you're sitting here talking to a 20-year-old who was trafficked for 5 years and now she's been put into and now she's doing this, and she's on drugs and she needs the money for her kids. And how can you, so that would be an example. I'm not looking at the end which you are, which probably the more macro end, meaning
hmm.
what's going on in the world, what are the groups. I'm more looking at the individual, which is how can you have these values of respect or integrity or spirituality, and yet do you realize who these women are and what they're going? Do you
Hmm.
think that most women want to stand there and strip in a closet in South America and be paid $1 an hour? Like, do you think they're having fun?
Hmm.
Whose daughter are they? So I think for me, it's really about humanizing these
Hmm.
women, and helping them understand. Also, for the guys, you're being used. Do you think you're so special? Do you think you're so important? Do you really think that that's certain things you're amazing?
Hmm.
Um, or are they making, or do they know? So it's all over the board. I know that I would say so many of the women I run into online are being trafficked and men. But
Hmm.
that's not how somebody who has a problem is looking at it. They're looking in terms of what they get out of it.
Right. No, thank you. That is so, I'm not kidding when I say when I was doing more work in it, I was like, we have to ask them, what if that you all have women in your life? What if it was that person in your life? How you have to view it that way. So I think that is really powerful. Like you can't differentiate the person from
the
You have to
behavior.
differentiate from not an object, not a consumer item to a real person. So
And why are
thank
they
you.
there? Do you think they want to just strip and,
Right.
be told to anyway? We're
Yeah.
aligned there.
Uh-huh.
Now, I do
Yeah.
want to say, and I think it's important for me to say, I'm not anti-sex. I'm not anti-orientation. I don't care about fetishes. I don't have issues with who you have sex with as long as it's legal and consensual. But those aren't the people I'm working with. I'm not working with people
Mm-hmm.
who are ashamed of their sexuality or hate themselves for what they're interested in. I work with people who have a compulsive addictive problem. They've had 7 affairs. And in
Mm-hmm.
between the affairs, they're seeing sex workers. And while they're seeing sex workers, they're doing porn. And so they have they have issues across the board, and um, the problem is not what they do. The problem is um, the way that they're approaching what it means to them.
Mm-hmm.
I'm not saying that some guy doesn't go to a bachelor party in Vegas and see a stripper, excuse my terms, but my clients see them every week, see them
Mm-hmm.
twice a week, and then they go home from work and they take a shower and they go, "Hi, kids, how are you?"
Mm-hmm.
And they have split lives, compartmentalized lives, is
Mm-hmm.
how they live.
Okay. Yeah, thanks for clarifying that. And as we think about our listeners who, there could be someone who's 21 and has decided they're going, much like you kind of had a path early on and went right into it. A lot of people definitely evolve in their who they're supporting and being trained in. Would you have any words of advice for people just kind of
Mhm.
delving into this? What would you share?
Well, I don't know if people are going through bachelor's levels or master's level or whatever it is that they might, or
Could be
2 year
both,
degrees,
yeah.
but everything I'm saying is fascinating and interesting. But well, because not because I said it, because it's a very interesting field. But number one, I didn't go directly into this. I worked on myself. I went to graduate school, and throughout graduate school, I thought, do I want to work with older people? Do I want to work with kids? This just kind of evolved as I realized I
Mm,
knew so much about this and others didn't. But I think, and I really mean this, to go to school and say, this is my agenda, I want to work with this population, is to miss what school is all about. In part of
mm-hmm,
my training in school, I had to work with kids.
mm-hmm,
I never really wanted to work with kids. I don't want to work with kids now, but to understand what someone who's abused goes through when they're 9 or they're 11, what it's like for someone to have a mentally ill parent. I'll tell you one more thing. It's like I work with therapists who are like, oh my God, this person's so troubled. Like, why are they, oh, they can't get along with their husband, they're fighting all the time, and they lose jobs. And I'm like, yeah, that's troubled, but work in a mental hospital where people are throwing shit at walls. And
mm-hmm,
then you really understand what crazy is. And you
mm-hmm,
need in so what I'm saying to folks is what I do is really interesting. I think many people say, "Oh, I want to do that." Get your basic education. It is absolutely essential, and have an open mind. You
mm-hmm,
know, um, you may find in school, and I did too. I really love this population. I had one of my interests, and this is was pediatric cancer wards. I wanted to work with parents who were dealing with the potential loss of a child. Part of it is, and that sounds really painful, but part of it is for us, all of us, I think, what can you tolerate? I can
mm-hmm,
do things, I can talk about sex like I'm talking about the weather. I can talk about death in ways other people, it's not just how do you, as a therapist, how do you not take it home? And that's a general question. But a larger question is, can you support and help this population and still be okay with yourself and be able to
mm,
do it?
yeah,
And I think that leads us into the areas of our work too, because some people, that's interesting, but I could never do that. Okay,
right.
well, that's not what you're going to do. But the main message is get the basics down. If you don't understand the difference between the needs of someone who is 19 versus the needs of someone who's 30, then you can't properly place the issue in terms of where that belongs in that person's lifespan. You have to understand development. So get the basics, and then no matter what gets you there, and then think about where do I want to specialize? And not everyone specializes, by the way. You have people who
Mm-hmm,
just see people.
right.
Does
No,
that help?
no, that's great. That resonates so much about you got to find the path of empathy for sure. I know in working in schools, how much, well, being there with the people and understanding why their behavior is so crazy. But then when you hear the stories, you understand so much more. And then
And
also, yeah, how
Becky,
much you can take and still live your own life is huge.
well, and again, that's can I be a therapist? Well, I have to be someone who can go home and put that there and then
Yeah.
live my life. I can't have it haunting me at home. And I hear stories, about something that happened to an 8-year-old. and they're pretty horrific, and I have to find a place to put that. And by the way, that's why I like working in a team, because we can
Mm-hmm.
sit around and talk about it, and even and I please don't be offended, joke about it, because sometimes we just need to get it out,
Mm-hmm.
so I think that in practice sometimes people are kind of lonely, and they don't even realize it, and they're not learning as much as they could be.
Mm-hmm.
So
No, team is huge for sure. Um, Anything else that you would like? We've talked about a lot of different things, had
mm.
some great perspectives from you. Anything else that you feel you want us to know about the work that you're doing, or anything else our listeners should hear?
Well, just to refer to some resources, and we could stop there.
Mm,
But before I do that, I guess I want to say that when I first started, I was working as a teacher with
okay.
uh, with disturbed kids, and it wasn't enough for me. Like, I wanted to have more individual contact, not be that person in front of the classroom. And I thought, oh, I
Yeah.
have these skills. I work with all the time. I can just I can just counsel these kids. I have the skills. I know what I'm doing. I know how to. And I had a really wise psychiatrist said to me, well, that may be true, but you still have to go to school.
Hmm.
You still have to have that degree. You still have to have the letters after your name, because that is, first of all, you'll learn things you think you know, but you don't. And second
Mm-hmm.
of all, no one's going to look at you twice. If you're like, oh, my mom was alcoholic and I've been going to Al-Anon for years and I really, really get this, and I'm a sponsor, whatever that means to you if you're involved with 12 step, and now I'm ready to help people in the larger world. No, you're not.
Mm-hmm.
First of all, there's things you don't know. And second of all, people are going to say, well, that's nice, but where'd you go to school?
Right.
You if you want to specialize in any area of medical or mental health, you have to be trained and you have to have those letters after your name. Just the way.
Mm-hmm.
And I was like, I don't want to do that. And she said, well, maybe you don't want to be in the field. It's like,
Hmm.
oh, right. That's how
Yeah.
it goes.
Yeah.
And I got my PhD at 55.
Awesome.
So I don't think you stop learning, because one more thing, this field of mental health, no one is ever bored.
No.
Every person that comes in the door has a different story, comes from a different arena, has different needs of me as a therapist. And so, from day to day, even people I was seeing for a while, I don't know who they're going to be that day. I don't know what they're going to come in with that day. I'm not their friend. I'm not their family member. And
Mm-hmm.
so, to me, it is always fascinating work, because it's not like I'm doing the same thing, every day. Who I have to be and how I use my skill set changes with every client I meet.
Absolutely. That is the life of a school counselor as well. You have a plan and then
Yes.
you just roll with it. Lots of flexibility and you never really know what's going to happen. So, um yeah, well, thank you so much for your time, Dr. Rob. And oh, will
Glad
you
to
go
give
ahead
it.
and share the resources you wanted to share? We talked about some of the books, but what else did you want to say?
Well, if you type in Dr. Rob Weiss and put in Google or whatever, and you put the word sex next to me, you will find, a lot of stuff. But my books are on Amazon. I have a little Amazon channel thing they give you. There's a
Mhm.
lot of my stuff and full trainings, actually, I've done for schools and stuff on YouTube.
Okay.
If you're interested in listening to professionals who talking about their field and their work, sex, love, and addiction is a great place to start. But all
Hmm.
roads for me lead to seekingintegrity.com, because that's where the free stuff is. That's where the work groups are. That's where we talk about treatment. Um,
Hmm.
and it might be good to learn, by the way, and I'll just say this, who needs to go to residential treatment? Who can do
Hmm.
well in going 3 nights a week at a program? Who does well just in outpatient therapy? Everyone who calls, I don't say, well, come on over to see us. It's a
Right.
constant evaluation of what that person needs and how they will best be served.
No,
The
that's a
last
great.
thing I want to
Go ahead.
say, and I want to say this to every one of you, my job is to be in the service of that person who's in front of me. That is my job. It's one of the reasons why I have to do my own therapy, and I think any good therapist does, because I need to understand in every moment, what is my motivation for saying this? People think sometimes, well, I'm paying this therapist, and all they're doing is sitting there and listening. Well,
Hmm.
if we're a good therapist, I'm not just sitting there listening. I am 100 miles an hour in my head. Should I say this? Shouldn't I say this? Oh, they said this last time. What does that mean? It is a constant process inside, and it's completely based on what meets the needs of that particular person.
Hmm.
And again, every person's different. They change with every person. Um, you do need to know the difference between regular therapy and addiction work, because they are very different kinds of work. And
Hmm.
anyway, as I said before, so yeah, you can find me. And by the way, I answer email. Unbelievable. I am
No.
Rob at seekingintegrity.com. And you can write me anytime and I will answer you resources, information. I know a bunch of therapists around the country who do work with these issues. I'm glad to make referrals. I want people to get what they need wherever they can get it. So
Yeah. Oh
that's
no,
me.
we're so appreciative. All the resources you're giving. I love how you pull in a lot of the volunteer people
Mm.
and just a wealth of knowledge. And thank you for offering all of those, along with the books you can buy and responding to email is huge. Not everybody does that. So that is a major benefit. So thank you so much for your time today.
Becky, it's a pleasure. And, I just want every person who's interested in the field to have the opportunity to make a difference. Um, and you may make a difference working with each person, or you may go up. Well, let me say this, and you can edit that out if you want, Becky, but I'll say this. One of the things I learned in graduate school, and this is my last message to you guys, is that some of us here's the deal. People are falling in a river and they're floating down river and some are drowning. There's people like me who stand at the end pulling people out and trying to save their lives. And then there are other people at the other end trying to figure out why they fall in. And
Hmm.
all of that is therapy, whether you're helping the system find more health and resources for people, or you're down at the other end helping people individually. The whole thing is work that's available to do.
Hmm. Great analogy. No, we talk about the babies falling in the river and who's fixing the gate and who's pulling them out. So I love that. All right. Well, thank you so much for all your insights and resources to our listeners. Please leave us comments, check out Dr. Rob's work, and continue to tune in on Mastering Counseling for future episodes in the world of mental health and therapy. Have a wonderful day.